Acara ini dipersembahkan oleh
Hello guys, I'm Iva and welcome back to Unhas Story. This episode will be different because here we have a guest speaker from Holland. She is Divera de Winter. She is a dentist from Leiden University and she is a resident in oral and maxillofacial surgery. Now, she is undergoing an internship program at Hasanuddin University Hospital and also Dental Hospital in Makassar. So today, she will sharing with us how is her experience during the internship program at Hasanuddin University. So without further introduction, let's meet our guest speaker. Check it out. Okay, hello Divera, I'm Iva and I'm the host of this program. So I told to Unhas TV viewers that our guest speaker today is coming from Holland. And I told to Unhas TV viewers that you are a dentist from Leiden University. So firstly, maybe let us know more about you. So please introduce yourself.
Oh, well, I'm a resident in oral and maxillofacial surgery. I'm currently 32 years old and I live in Holland, in a city called Leiden. Leiden is a small city near Amsterdam, about 30 minutes driving from our capital city, Amsterdam. And I started my studies, my medical study in 2011 at the Leiden University. Which is our oldest university, being internationally oriented, with over 3,000 international students, coming from over 100 different countries. And after I became a medical doctor, I went to the east of our country, to Nijmegen.
Okay.
And there I became a dentist. And afterwards I came back to Leiden again, this time to the Leiden University Medical Center to start my residency in oral and maxillofacial surgery.
Okay, so next is what brought you here? Why did you choose Hasanuddin University for your internship program?
Well, because of the good relations between my current professor, which is Professor Dr. Verhoesanvar, and Professor Dr. Ruslin.
Okay, Professor Ruslin, yes.
I had the opportunity to visit Hasanuddin University for an internship during the final months of my residency. And both professors, they know each other really well. They're befriended. They studied together. They performed their PhD studies in Amsterdam together some years ago. And for me, it was the opportunity to gain experience in cleft surgery, taught by local experts here.
Okay, so Prof. Ruslin is our vice rector at Hasanuddin University. So you mentioned about cleft surgery. So is it not much performed at your university or your hospital?
Indeed, in our hospital, no cleft surgery is performed, and not all the oral and maxillofacial surgeons in Holland are able to perform cleft surgery. And that is because of the low prevalence of cleft patients in Holland. So they decided to centralize the care for cleft patients, meaning that only a few oral and maxillofacial surgeons in Holland are able to and allowed to perform cleft lip and cleft palate surgery. and only in a few university hospitals. And the rationale behind this is that if a condition is rare, you should be able, as a surgeon, to perform your surgery enough times to be able to get the best care for the patient. So that is why they decided to centralize the cleft patient care in our country. And here it is much, much more common. So the prevalence of cleft surgery patients is much, much higher. So that is why I went to the Hasanuddin University to gain more experience and learn from all the knowledge of our colleagues here. So I attended in cleft surgery in the Hasanuddin University, but also in the dental hospital.
Okay.
And we also went to Ambon.
Oh, Ambon.
For a charity event, just to perform cleft surgery in patients from rural areas who were not able to afford medical insurance. So we went there with a group of people all coming from different islands and different cities to perform cleft surgery in these patients, all with the same goal, being taking care of the young children and the young adolescents, willing to give them a better future. We also did yesterday, the Hasanuddin University organized the fun run, the 5 kilometers fun run, also organized by the Smile Train organization, who was also in Ambon the one who subsidized the charity event. For me personally, it was pretty hard to do the run because I'm not used to your temperatures and the humidity here, but we made it to the finish.
Okay, so how long will you be in Makassar?
I will stay here for a month.
For a month, okay.
And this Friday will be my last day in Makassar for now.
For now.
For now.
Okay. According to your experience, what struck you when you first arriving in Makassar? Maybe there's something that struck you, make you maybe just say like a culture shock like that.
Well, what struck me first was the huge hospitality I received. When I just came to Makassar, we directly went to one of your beautiful Finisi boats to see the sunset, and I knew nobody on the boat yet.
Okay.
So in the beginning, I was a bit quiet, but all the people there made me feel so comfortable that I just went to have dinner with them together, and they made me feel like part of the team.
Okay.
So that was really nice. I think that's what struck me the first. The second thing what struck me really was the taxi drivers when I arrived at the airport. Well, because when I arrived at the airport, the taxi drivers, at least I think 20, came to me and offered a taxi drive to Makassar. And I'm just not used to that because in Holland you need to wave and then a taxi driver will come to you. But in here it's the other way around. They just come to you and you need to pick one out of the many options you are offered. So that's different, and also the traffic is really different.
The traffic, okay.
Yeah, we don't drive at the left side of the road, so that's different. And also at the crawling of the cars around each other, not always following strict lines. The use of the horn of the car to warn, and also the people who help you when you need to turn or you need to park, and you pay them just a little afterwards. That's not
You
where
never
I
found it
never
in your
found it
country.
before. No,
Okay.
no.
Okay.
So that was the first, and also noteworthy, I think, is your wonderful Indonesian food.
Mm.
I got to experience lots of your food, for instance, kondro and soto ayam, and I also preferred much.
Soto kondro ayam.
Yeah, and if I need to pick three, the last one I think will be the seafood.
Oh, the seafood.
Yeah.
Okay.
Yeah, I really enjoyed that. I only need to watch your spiciness
Okay.
because sometimes for me it's a bit too too spicy. To handle. But well.
Okay, you mentioned about the traffic and then maybe some of the new habit or new activities that you maybe this the first time you found it in another country. So how it is it difficult for you to adapt with these things?
Oh, well, I think that because of all the people being so kind, so nice, and showing me the way they have their habits, for me it was easier to get used to all these habits. For instance, they teach me how to use my hands for eating the rice, and I just followed them. They showed me how to do it, and I just followed them, which I think made me able now to adapt to your habits.
Okay, so people around you help you to adapt with this thing.
Yeah, they really did.
About the food, you said the three menu. I think let's say like as your favorite, most favorite food in Makassar, soto, kondro, soto ayam, and seafood. So why you choose this menu?
I think I chose the kondro and the soto ayam, especially because of the complex flavors. I think you use different spices than I'm used to experience in Holland. And for the seafood, we also have seafood, but in here it was so fresh and so purely prepared that I think that made it different from the seafood I experienced in Holland.
Okay, so next I heard that in your internship program at Hasanuddin University, you also present a lecture in the class. So how about the student? How they interact with you? How about their English ability?
Well, I got the opportunity to give a lecture about non-odontologists' findings on panoramic radiographs, especially focusing on the soft tissue opacities. And I think that the students, they seemed interested. They took all the notes and they took some pictures of the slides. And afterwards we had this Q&A session where they were able to ask
with English
questions in English. And I think that went pretty well. There were a lot of questions asked, and the questions which they asked were also questions which were able for me to see that they understood what I was telling them. And also I was able to understand their questions. So I think their English is pretty good.
Because we have a lot of international students too in Hasanuddin University. So
they also participated.
Okay. So talking about bahasa, we talked about our student English ability. So now I'm feeling curious. How do you think about bahasa? If the rating is 1 to 10, how would you rate bahasa?
Well, for me, bahasa was completely new.
Okay.
And before I came here, like a month before I heard that I got the opportunity to visit Makassar, so I directly went to a bookshop and bought an Indonesian dictionary and a phrase book to practice a bit. And I think for the Dutch citizens, it is a language that we can adapt to. We also share some words like apotheek and hallo. So I think for me it's difficult to give it a rate because I have some experience with it now, but not enough yet. So rating will be difficult, but I hope in the future to be able to learn some more, and maybe then I will be able to ask your question well.
Okay. Does it mean you learning bahasa before you take this internship program? Or?
Yeah, about a month before I started to practice a bit. I can understand some of the words, some of the sentences, but I'm not able to speak it well. I know makasih.
Okay, makasih.
But yeah, I need to practice a bit more with the rest.
Okay, lastly, would you recommend other residents in Holland to visit Hasanuddin University?
Definitely. In my opinion, especially the huge hospitality and the huge experience with the cleft surgery, and also the Indonesian culture and the food are I think the most important reasons to come over here for internship at the Hasanuddin University. So I would definitely say yes to that question, and I think I hope that we got the opportunity in the future to be able to keep sharing both knowledge and skills between both of the university. I hope it will be strengthened in the future, the connection which is already there.
Okay. Do you plan to come back after your internship program?
I hope that I'm able to come back, but then as an oral and maxillofacial surgeon, so maybe.
Okay, is it enough? Okay, you want to make add or nothing? Is it enough?
I think it's enough.
Okay.
Maybe I want to thank you for this opportunity. You all, and also the people who were here during my time.
Okay.
Especially Professor Ruslin, Dr. Joshi, and Dr. Caroline, who were helping me and taking care of me so much. So I want to thank them.
Okay, that is the closing statement from Divera. So guys, that is our Unhas story in this episode. Thank you very much for Miss Divera, and also to Unhas TV viewers who always watching Unhas story, and don't forget to keep watching Unhas TV to access the other interesting program. I am Iva and the other working team. See you in the next episode, and bye-bye.
Acara ini dipersembahkan oleh